got Raj Padwell, MMHG. So a big thing you guys are doing is you're focused on blood pressure measurement and service delivery. Can you tell us a little bit about what exactly MMHG is and kind of where the concept and the idea came from?
Sure. Well, first of all, I'd like to say thanks for having me.
Absolutely.
Basically, it's born out of a frustration with seeing people managed maybe incorrectly or suboptimally. And I'm a expert in high blood pressure, and that's what I've done a lot of in my career. And what the company is about is getting people to monitor their blood pressure properly and collect that data in a way that is useful for them and for their providers. So we started off with blood pressure, and now we're also expanding to blood glucose and other things.
That's awesome. And that's your stage 2 you were saying, correctly?
Yeah, right now we've made a foundational platform, which is what we would call a blood pressure telemonitoring system. And that system really consists of an app, a smartphone app. It's available in 4 languages, both on Android and Apple platforms. And then what people do with that app is they are able to enter their readings or Bluetooth their readings in. And then those measurements go to the cloud, which is stored on our server. All of this is securely done. And then following that, we can link that with a provider. And we average it in a special way that we've patented called swipe averaging. And so that allows individuals and clinicians to practice proper medicine.
Gotcha. Yeah, you were showing us some stuff off camera that looks super amazing in the fact that with your averaging, your blood pressure averaging. So what does this mean for the average user? And how is this going to, I mean, this sounds like it's a pretty disruptive thing for the healthcare industry in a really great way. What does this mean for the average user of an application like this?
I think what is available right now in terms of applications is suboptimal because it doesn't really average or collect the data in a way that's useful to clinicians. And so that's really what we've tried to do is change the way things are flowing into the system so that when people get the data and show it to their provider, it can be shown in a way that's useful to the provider.
So just to kind of give a picture to our listeners and our watchers, the traditional way of getting blood pressure monitored and you'd have to do multiple visits to the doctor, get a blood pressure test, which may or may not be as accurate as you like because of that elevated pressure of them attending the office, and then they'd have to go away, come back at a later date, get another test done, so forth and so on. Then they would average that, and it doesn't really give us a good picture of it. And so what this application is going to do is give us a more accurate, it's done more on a freely basis by the individual. I like how you were saying earlier how it gives ownership, gives back ownership to a individual's health data. So that's basically what we're talking about here.
Yeah, ultimately we want to pivot this to a platform where users own their own data. But we had to start somewhere. And so at the very beginning, we built this foundational system, which is similar to a lot of systems out there, but the major difference is it enables individuals to also share the data with their provider in a way that's really easy for the provider to understand it.
So we've talked a lot about you guys doing a lot of research in Latin America right now, and you've talked about a lot of the success that's happened in North America, in the United States. Can you talk to a little bit about what they're doing down there that's something we need to start adapting and adopting here in Canada?
Sure, I think, Bryce, there's going to be a paradigm shift, and it's already happening in a lot of places in the world. I think, unfortunately, Canada has been a little bit slow to adopt some of these innovations. And what I'm specifically speaking about is the ability of a patient to, in a virtual manner, call up a provider and get information and advice from them. And so when you pair that virtual kind of care with the telemonitoring system that we have established, then care becomes more powerful because you have an individual user who maybe be more informed, so the patient is more informed. Secondly, people don't have to travel long distances to go and see a provider and wait in the big room and then wait in the small room and then get some advice which may or may not be accurate because sometimes it's out of date. So you basically have an empowered user, and that's really the vision that we are trying to create with this company in helping people to monitor their blood pressure properly. And so one of the use cases for high blood pressure would be where a patient goes to an office and gets a blood pressure measurement, and that blood pressure measurement is spuriously elevated because of something called white coat effect. See, the last blood pressure measurement that you want to use when you're managing someone with high blood pressure is an office measurement. You want home measurements, but you also want them to be collected in a certain way. Unfortunately, a lot of the systems out there don't collect it in a proper way and average it properly according to the way that the guidelines, based on the original studies that were done in the literature, say that it should be done. So one of the biggest use cases here is to have people monitor the blood pressure at home and average it in a certain way, and then provide that information to a provider instantly.
Right.
So really that's the kind of thing that we're focused on. When there's mismanagement, unfortunately, it leads to bad events. It leads to a patient having a heart attack or a stroke if they're not properly controlled. Or on the flip side, it leads to people being overtreated. If they have a blood pressure level in an office setting that is spuriously elevated and not representative of their true blood pressure, then unfortunately what happens is they get put on blood pressure medication and they may fall and have a fracture. And we see this kind of stuff both on the high side and on the low side. We see it all the time.
Yeah.
And so really our vision is to try to get people to be empowered, to understand how to monitor their health, to do it in the best way, the best recommended way, and then share that with their provider in a way that can be actionable.
Well, and it's, you said earlier in regards to getting back to best practices and but just making it a more virtual environment and more effective. I also want to touch base a little bit on, we've talked about, you and I in the past, on making those bridges happen in case there's an event where a patient goes and sees one doctor over here, one doctor over here, one doctor over there, and they're getting all these different readings or these different diagnoses when it comes to drugs, and we can kind of eliminate that through an application like this.
Yeah, so
or at least manage it, I should say.
Yeah, so when I talk about our foundational platform, which is the blood pressure and blood glucose and weight telemonitoring that we've done so far, it's still done in a way that, well, in essence, we don't really like. And that way is where a private company like ours silos the data, and basically, as a user, you'd be giving us your data, and then we're trying to create value out of that data. But in a way, in our case, and in many cases, we have goodwill intention. We want you to get healthier and have you share that data with someone else to make you healthier and get better managed. But I think what we really want to do in the future, and this is a minority opinion and a bit of a controversial opinion as well, is we want you to own your data. And so what we want to do is we want to be a broker that helps you to collect the data properly and make sense of it if it's just you that wants to make sense of your data. On the other hand, we also want you to have the choice to take that data and send it to whoever, whether it's a healthcare provider because you need an opinion, whether it's a caregiver or a family member because you may be getting older and need some help and someone to watch over you, and so that's a big need in society now. Or even the more radical idea of maybe if you own your own data, you might want to monetize your own health data. And so really we're focused on all of these things in the long term, but we had to start somewhere, so we started with the siloed data private company model. But ultimately, we want to flip that model into one where the user is owning and controlling and directing their data and making sense of it and using it to improve their health.
Gotcha. One thing I think that, in my mind, if you have more ownership of your health information, you're even a little bit more responsible with your own health. You know, you start looking, if you can actually see it and you understand it better. I think a lot of people go to doctors and just say like, well, they know best. They'll just give me whatever and away we go and hope for the best. But in this case, if you've got more information, the more power you have over yourself as well. And I mean, I can see that could be a controversial, thought process as well, because some people might take it too far.
Well, very, very much. And it's even controversial to even step that far, because some providers would tell you, well, we don't think it's appropriate for a patient to be researching their own condition. It might be better if they just simply took our advice.
Right.
That's okay. I mean, that's really the paradigm that I've grown up in. I've been in practice 17 years, and I trained prior to that. I trained for about 10 years, and so really I've almost been in this field for 3 decades in medicine in general.
Yeah.
And that's really when I started my practice and my training. It was a very top-down, paternalistic type of view. But it's changing. It's changing, Bryce. And maybe in Canada very slowly or not much at all. But I can tell you, you can walk into a pharmacy in the US and you can go to a terminal and you can call up a provider and you can tell them about your problem. You may even have your own diagnosis because you've researched it, and then you can get what you need. And you look at on-demand banking or other services that are being enabled by technology. There's no reason why healthcare is going to be different. It's not going to be different. It's just going to take some time to change.
Yeah. Well, I like one of the examples, again, off camera, you and I were talking about in regards to, if someone has an issue, they might be able to dial up right away a doctor right from their phone and say, hey, I've got this problem. Then they can share that data straight to that doctor and get a very accurate, if not bang on, solution to the issue that they're having, and it's all done virtually. And I mean, a big push for this series, and is the future of health and how future is moving forward. And this is a prime example of a potential of that future, and to make it more sustainable, more accurate, like we were saying before. So this is a really cool initiative that, and we've had this discussion too, that Canada is kind of a little bit behind on, so and for multiple reasons. So let's talk about some of those reasons really quickly in regards to what are the things that you need to get this to the next level.
So I won't give away exactly the ideas we have for our platform, although I think knowledgeable people might understand where I'm going with this. But at the end of the day, flipping that platform so that patients own their data and can direct it, that's something that a fairly small number of companies across the world are now working on. Not a lot in Canada. So I would say the number one obstacle or challenge is that not a lot of people in Canada are working on this.
Gotcha.
So we have to look internationally for guidance and for collaborations. So that sometimes limits the degree to which things can evolve. But I would say that a bigger issue is probably the issue of the lack of competition in Canada. And so everything is kind of monopolized. So you may have a company that owns most of the electronic records or systems like that. And while that may be a great company, there may not always be an incentive to pick up innovation or push innovation forward if you don't have 5 other competitors pushing you forward and keeping you innovative over time. And then I guess a bigger issue would be the fact that we have public health care, which I'm a big proponent of, but one of the problems with public health care is you have managers and administrators that maybe aren't rewarded for taking risk, maybe have really no one looking over their shoulder in terms of a competition to which a customer, i.e. a patient, could go, right? Because it's really, I mean, there's one game in town. And so when you look at, for example, an entity like Alberta Health Services, it delivers great care in many ways, but is it an organization known for its super innovation and willingness to push the envelope forward and adopt cutting edge strategies? No, I would say it's not. And so when you're a healthcare practitioner who's also an entrepreneur, trying to innovate for the sake of innovation and to try to make things better ultimately for patients and providers, you often will have to look outside of the province and the country to really get like-minded people to collaborate with, and also learn in terms of what's happening on the cutting edge, and move forward.
Yeah, and I mean, we're in a changing world that's changing very fast between population growth and then just technology growth, obviously. And we need to be able to make it more sustainable, and innovation is the key to that. So, I mean, from what it sounds like, we're just a little bit complacent. We've gotten a little bit complacent with the systems, but it's starting to catch up to us. So we need to kind of pick up the ball and start rolling with it. So for you specifically, I know we've talked about exposure, like just for your own growth is getting more exposure, having more people hear about what you're doing, but also like partnerships, and looking for that open dialogue and willingness to adopt at least the trial versions of what you're doing, so that we can kind of get this thing going. And that sounds like that's one of your biggest roadblocks right now.
Yeah, and that's why doing something like this is great. It's great for us because we're able to get the word out in terms of what we're doing. And I guess, if you will, it allows us to be legitimized in many ways. I can tell you, when you do like LinkedIn outreach, or when you do cold calls or cold emails to people, even if they're even if from the point of view you can state that you're a practitioner in this field for 2 to 3 decades, it doesn't resonate as much unless people have heard of you or have seen something on you. And so I think it's a big issue for us, MMHG.
And I think for a lot of people.
There's
a lot of innovators out there right now that are trying to get these things out the door that are revolutionary, and are there with the right nurturing to take us into the next evolution of healthcare, the evolution of our country and our economy. So I think everybody's kind of going through that piece. But really trying to get people to come in and meet you, and I mean, we'll have links in the video here for you to come and have a conversation with you and open up that dialogue. So.
Yeah, and I think I would add, I was never an entrepreneur, Bryce. I mean, I never really thought, if you told me when I began my career that after the second decade of my career I would be doing a startup or two and trying to commercialize products, I would have said you were crazy. But the one advantage we have in Edmonton and in Alberta and in Canada is that there are a lot of very well-trained, very hardworking people in this country, coming either from the country itself or immigrating from other places. And we don't recognize that enough. And so when you get together a clinician who has a lot of experience in a certain area, cardiovascular risk in my case, and you pair that with other clinical experts plus people with expertise in software development and computing science or hardware engineers, then really innovative stuff can happen. But the problem is that step isn't usually taken. And I took the leap, I took that step, and I'm grateful to National Research Council for funding us and Alberta Innovates for funding us. Those are our two major funders. But I think not enough people take that leap, and that's a big issue.
Yeah. So can you tell us a little bit about some of the people that have helped you along the way to get you to where you are today?
Yeah, sure, I'd love to. I think the biggest thing I would say about people helping along the way are the early adopters. So we love the early adopters, and you don't find a lot of them in Canada, maybe more so in other places, but just physicians or healthcare providers, colleagues, patients, a lot of times it's patients, telling us, I love this system and it's great you're innovating, and if there's anything I can do to help, review it or give you feedback or trial it out, I'd love to help. And a lot of times these early adopters, they don't ask for anything in return. They just want to help you succeed, and they love the fact that you're trying to innovate. And then there's a lot of entities that really are geared toward this as well, and I would say Health City is a great example, and Reg Joseph. So Reg and I went to school at the University of Saskatchewan way back when, I won't say when. But I think he's he's an example of someone, and Health City is an example of an entity that is trying to help startups and innovators like us get our message out and push things forward. So, we've received a lot from them, and we're very grateful as well.
Super.
So, yeah, and then of course the funders. I've mentioned the funders, but Alberta Innovates and National Research Council, IRAP, those are our two major ones, and really none of this would have been possible without them.
You betcha. Right on. Well, it's good to see that you're getting some of the support, and that's happening here locally. I know that that's something that we've talked to a lot of people about, that they're not seeing a lot of local support, and they need that to kind of get them to the next level and get them out more into the world, even just nationally across the country. So it's good to hear that that's coming from locals and local organizations.
Yeah, I think also the university, being university-based, that's another entity that has helped and nurtured us along. So I'd be remiss not to mention them. And then I think overall, if hopefully some of us become somewhat successful, because I think that's one great thing about Edmonton is it's starting to get a critical mass in the ecosystem. And when people are successful, they like to give back, which is maybe a little bit more than in other places that I've noticed. So that's something that hopefully we can say one day we're able to do.
Well, Alberta is a great place to be. Canada's a great place to be, but Alberta right now is just, we are such a catalyst. And you've alluded to it before too, in regards to just the great minds and the great talent. We have a phenomenal physicians here that they just need to have that support underneath them. The foundation needs to be strong, and then they can adopt these things carrying forward. They're not going to be obsolete. This is just a tool to help them be better.
Absolutely.
And to help their lives easier. We talk about physicians being overworked, and they're doing insane amounts of hours, and they've got overloads on patients. This is just helping to relieve some of that stress. It's a tool, and that's what it's to be looked at. And the more tools you have in your toolbox, the better. You should never turn down a tool.
Time is probably the biggest reason why things fall off the rails. And so that's what we're really trying to do, is get some innovations that make things very efficient and minimize the amount of time to also provide best practice.
So what's the future right now? What's the next steps that you guys are taking with MMHG? I know that you're going overseas to do some more research work and doing some education on the program. What are the next steps for you guys? What's the future?
So I think with Sfigmo, we've created the foundational system. And we're in a good position in some ways because in the US, blood pressure telemonitoring and telemonitoring in general is reimbursed actually quite well. And so it's a crowded space, but we hope to partner with companies in the US and push forward some of the products we've made, because we've spent a lot of time making these products, and they're very clinically focused, and they're unlike what's out there in terms of some of the innovations like swipe averaging, for example. And so we're hoping that we can take that and either get interest in terms of other telemonitoring companies licensing, or partners that will allow people to telemonitor using our system. But we're not done. So that's the foundational system. And then stage two, we're really working on more personalization. So one of the things that's really forgotten by clinicians often is all of the other things that happen outside of the office that affect these conditions, like high blood pressure. So for example, your salt intake. Someone may ask you about it, but they don't spend a lot of time on it. Your weight, your stress level, your sleep. And although there are systems out there that analyze those things, we want to do it in a better way. So we've got 3 months of work to do, but we're going to come out with a personalization segment to our platform that people can go through and then really understand what are the triggers for a rise in blood glucose or a rise in blood pressure.
Gotcha.
The second thing we want to do in that second part of the platform is funded by the Canadian Space Agency through the federal government National Research Council IRAP program. And that's really creating what we call an AI-based treatment guide. And in this case, we mean AI, not artificial intelligence per se, but augmented intelligence. And what that means is a user of our system can pick it up, enter their data, and then they can get a guide of, well, if you have high blood pressure and diabetes, then you should be on this medication first. And given your blood pressure levels, you actually should be on that medication. And your target level should be this. And what you should watch out for with that medication is this. But then furthermore, as they continue to monitor, what that augmented system will do is take their new data and say, okay, you're doing well on this medication, but you're not at target yet, and your next medication is Y. And so some people might say, well, that's really just my role as a clinical specialist, and it's true. What I'm doing is I'm taking my 20 years of experience in the field and I'm putting it in a program so that a user who's uninitiated and hasn't had 20 years of experience can immediately say, oh, this is what I need to be on. Hey, wait a second, I'm only on this. And this is my target. Wait a second, I'm way above target. And to a certain extent, what we're trying to do is help people, but we also recognize there's some great physicians out there and healthcare providers, but there's also lots of instances where people don't get the right advice and they're not on the right medication. And we want to change that for blood pressure first and then blood glucose. And then the third part of the third part of our plan ultimately is to flip this platform so that you as the user are owning your data and directing your data and benefiting from your data in all of the different ways that can happen. And communication between different kinds of systems is enabled. But that's going to take time and a lot of collaboration. But that's probably the most exciting part of what we're doing.
No kidding. Well, it sounds like it's a very big world that is open to be explored, and there's a lot of opportunities there. And I'm glad that someone that's local here that's touching into that is on the ground floor and writing the book for this. So that's super great. So thank you for all the work that you are doing, and thank you for coming in and sharing this with us today.
Oh, my pleasure. Thanks
Awesome.
for the invite.
Definitely.
What that's called?